Hey y'all, we're at part 4 of the series, Polyneuropathy of the Peripheral Nerves. Yes, I have on the same clothes. We're just recording right along from the last video. So in this part of the series, we're going to talk about from our abdominal area on down to our feet. So I have to make this disclaimer. Some of this information may not be what you want to hear. You may not want your children to hear it. I don't know, but it is what I went through, so I have to discuss it so that if someone else has these problems, they won't be ashamed of it and they will discuss it with their doctors or whomever they need to discuss it with. So when I started this process in 2003, like I said in my previous video, I went numb, sort of slightly numb, not completely numb. I would say maybe 40% numb on from my right breast area all the way down to my foot. So it was like it made a straight line through the middle of my body all the way down. So my left side wasn't affected. The left side of my abdominal area was not affected. Y'all, I'm sorry. My Ring doorbell is just chiming when people go by, so I apologize for that. But my left side was not affected. I had no problems with my arm. My right side, my left side from the breast all the way down to my toes. I had no problems. But when you went straight down the body, that's when you went into the vaginal area. So I had no sensation, no sexual sensations. I had none whatsoever because it's like I said, I went numb from my chest area, my sternum all the way down, straight down. So it's like it cut it in half. And one half didn't work, the other half didn't work. So I dealt with that. I went to a doctor. They couldn't do anything. They gave me some, I can't remember what the medication was to try to help with that, but it didn't help. So I just learned to deal with it. I didn't have any sensation. There was no, the O word, didn't have those. It just was what it was. So now the pain and the numbness from my left leg on down, I started having problems with a sciatic nerve. And if you know your sciatic nerve, it runs from your lower back and it can go all the way down the back of your leg to about mid-thigh area. So I had that pain, and that pain can be debilitating all in its own. So you have problems with walking, and sometimes I had problems sitting. So I had to kind of lean to the side to get pressure off of that side. But I dealt with that. They started me on some different meds like gabapentin. I had to stop the gabapentin because it caused me to have hallucinations. Not saying it's going to happen to you. And then I was on Lyrica, Cymbalta. I had to stop the Cymbalta because I developed hepatitis. Hepatitis is an inflammation of the liver. Some people get confused when you say hepatitis. They think either A, B, or C, and they really think C, which is the one that comes from contact with blood products when you using someone's toothbrush, using someone's razors. If they have hepatitis, it can be passed that way. Hepatitis A is for when people work in the food industry and they go and use the restroom, don't clean their hands, come back, deal with your food, pass it on to you. So I didn't have any of that. I just had the inflammation of my liver. My eyes were yellow. I was jaundiced. I was really, really tired, really, really fatigued. I was at work, couldn't stay awake. And so finally I went to the hospital and my liver enzymes were out of the roof. I wound up staying in the hospital for 5 days until they got that under control. So I had to get off of that medication. And then I started having these tingling sensations in my lower leg. Now, this leg, my right leg, has been giving me problems since this all began. Like I told you, I wasn't able to, while I wasn't able to kind of walk because this leg was so numb, but the feelings came back. I started to develop foot drop. So with foot drop, your foot is on a level like this. But with foot drop, your toes kind of bend. So when you walk, you have to lift those toes up. So if not, you will drag them and you can trip and fall. I myself have fallen numerous times. I haven't hurt anything. I just have a lot of bruises on me from when I have fallen. And I think I will try to show you all how I walk and what it looks like to have foot drop. Some foot drop is worse than others. Mine isn't that bad. Some develop really bad. And usually with the foot drop, since you're trying to compensate for the lack of the use of your right leg, you can get a lot of pain on your left leg because you're trying to compensate for what actions you don't have, what use of your right leg you don't have. You try to compensate for that by using your left leg a lot. So I do have a lot of hip pain, nothing that shows up on a CT scan or an MRI, but I can tell that it hurts, sometimes when I have to overcompensate for the lack of movement of my right leg or my right foot. So I developed that. I do have a brace for that, and we will look at that and get into that. I haven't had it long. I've probably had it for about 3 months, and I do wear it sometimes, but other times you really, to me anyway, I don't want to, it kind of connects around. I'll show it to you and then we'll discuss that and why I don't really wear it a lot. But I do use a cane now. Around the house, I don't use my cane because I can kind of maneuver. But when I'm out and about and we may be walking for a while or a long distance or in a crowded area, I will use my cane because, like I said, I do have a very unsteady gait. Even with my cane, I still have an unsteady gait. So I have to try to make sure I don't run into someone or fall over into someone and all of that. You just have to laugh at it because, it is what it is. It's your life. What are you going to do? If you cry about it or feel sad about it all the time, you're going to be really depressed. And I have been through depression before, dealing with all of this. But, you just have to put your faith in God and let it move from there. So I just trust in God that everything is going to be okay, that he's not going to put more on me than I can bear. And like I said, I've been dealing with this for 20 years. So he hasn't failed me yet. But so with all of those issues and the unsteady gait and people thinking you're drunk or you might be on drugs because of the way you walk and you're running into things, walking into things, falling over and all of that. But you just have to do the best you can with what you have. I don't have a true diagnosis of what all of this is other than the polyneuropathy of the peripheral nerves. So that means I have dual nerves that are misfiring or not communicating the way they should. And most of mine are in my lower legs, my lower body. I have had an EEG, electroencephalo. Okay,